We wanted to get a medical professional's opinion on that.
So this morning we were joined by infectious disease specialist Dr. Dana Hawkinson, University of Kansas Health System. As always, doctor, we're glad you're with us this morning. Masks are going to be even more of a thing as people head back out. So health officials say it's clear that droplets from coughing and sneezing and talking can spread COVID-19 from person to person. Here's the big question everyone wants to know. How far can droplets travel? If I go to the grocery store, am I okay just on my aisle? How far can these go?
Yeah, in general, the droplets are going to be pretty large. Those are the droplets that we're concerned with. You know, we can't see them, but in terms of droplets that you can expel if you're coughing or sneezing, they're going to be pretty large. For the most part, they are going to fall to the ground, probably between 4 and 6 feet. Maybe some will get up to 7 or 8 feet. But they are pretty heavy, and so they will drop to the ground. There have obviously been images or studies looking at spread of droplets or even microaerosols after coughing or sneezing. But even if it does that, you know, you're pretty safe. There's been some images about maybe going over grocery store aisles, things of that nature. But when that happens, number one, the concentration of the droplet or the microaerosol is going to be so small that it's probably not going to be significant. The major things that we're still looking at are going to be the bigger droplet sizes. And again, those are probably going to fall to the floor at 4, 6, maybe possibly even 8 feet. But even at that point, the concentration of those droplets is going to be so much smaller compared to closer in to the cough or the sneeze that it's not going to be as significant if you are around somebody who's doing that. And that's really why the 6-foot range is the common distance that we're talking about here.
So, Dr. Hawkinson, when it comes to masks, we've gotten to the point where we understand that the mask cannot necessarily protect you from getting sick completely, but it's more to stop your germs from spreading to other people. When it comes to stopping something from escaping your, mouth and nose, how effective are masks at stopping those droplets?
Yeah, again, the masks we're talking about here are not biomedical grade. We're not using these in the hospital to see patients or have on our patients. But that's a very good question because we know masks are causing so much consternation and trouble now around the United States. Again, it is to protect other people from you should you cough and sneeze. Those masks are somewhat, pretty good protection about stopping those larger droplets. It is still cloth masks for the most part, so you are going to have airways so that you can breathe, so you will have airflow through there. But for the most part, they're pretty good at, again, decreasing the concentration of those droplets and decreasing the overall amount of those larger droplets.
Doctor, we ask for questions from viewers all the time. We actually had a nurse reach out to us about this one, and she asked if we could demonstrate how to properly wear a mask. You have done that. You've talked about that with other people. What are the do's and don'ts? What's the best way whenever you're putting the mask so you keep yourself and others safe?
Yeah, whether it's a homemade cotton mask or cloth mask, or say one of the biomedical grade surgical masks that people can buy in the stores now. The best thing to do is prior to putting on the mask, do hand hygiene, either wash your hands or use alcohol sanitizer. And then take the mask by either the loops, the ear loops, or the strings or the straps, and then put the mask on and tie the mask, or put the ear loops around your ear. When you have the mask on, it's very important that you're not continually touching or manipulating the mask, as this causes contamination of the mask and potentially contamination of your face. And then once you're able to take the mask off, again, do hand hygiene to clean off your hands, either hand washing or hand sanitizer. And then again, remove it the same way you put it on, either by the ear loops or by the straps, not pulling the front of the mask off.
Well, it's something we all, if we're not used to yet, are going to have to get much more used to as we head back out into the open a little bit more than we have been recently.
Yeah.
Dr. Hawkinson, thank you so much for joining us. He's going to join us again this morning at 6:45. We'll have more questions then.